You've likely seen that now viral video of a Black mother in pain at an Indiana hospital. It resonated with viewers and healthcare professionals who saw it. And as we reported yesterday, it sparked new legislation, the Wells Act, that aims to protect pregnant people who are in labor. The legislation is in response to images that show Mercedes Wells crying and in pain at Franciscan Health Crown Point. Wells says she was in labor for 6 hours and seen by a nurse, but she was ultimately discharged without ever seeing a doctor. Minutes later, she gave birth in her car. The Women Expansion for Learning and Labor Safety Act is being drafted by Illinois Congresswoman and Democrat Robin Kelly, and that representative joins us now. Thank you so much for being with us.
Thanks for having me.
This is a pretty swift response to an incident that happened just over a week ago. Why now? Why is this so important, and what's in it?
I've been working on the issue of maternal mortality and morbidity for about 9 years. So this is just another chapter of what we've been working on for a long time now. When I first heard of how bad the problem was, and especially for Black women. So that's why it's swift, because, you know, it's a big part of my portfolio. It needs to be done.
Yeah.
Nothing to play around with.
And in response to our reporting, a midwife called me and said, I don't understand why we need the Wells Act. This should already be happening. You're calling for two specific things: racial bias training in hospitals and a safe discharge plan. Talk about why and what that would entail.
Sure. First, it would have to be the justification for the discharge, an assessment of, if you discharge her, you know, how long is it going to take her to get to where she's going, the time. Also, does she have an understanding of why she's going? Does she have reliable transportation to get to where she's going? And where is the hospital or the health center that she's going to, or the birthing center?
Are you confident something like this will pass? Right now, you've championed a number of pieces of legislation, including the Mamas Act and the Care for Moms Act. What makes this different?
I don't think it's different. We've gotten some of those pieces of legislation passed, or pieces in them. I think that I have a co-chair of the Maternal Health Caucus. She's Republican. And when I get back, I'm going to speak with her about what happened. And hopefully, especially the women, will see how important this is.
You said your co-chair is a Republican. Why do you think this will have bipartisan support? Is this an issue that resonates?
Too many women, period, die in the United States. We don't rank well with countries like us. So women are interested. I mean, all kind of women die, but Black women die more.
And you clearly have been a leader in this space. I know that you are part of the Congressional Black Caucus, Brain Trust, the Congressional Caucus on Black Women. And still, the numbers are very, very bad for Black women in the United States, still 3 times more likely to die from pregnancy-related causes than their white counterparts. So it seems that the legislation is not doing enough. What's missing? What's the missing link here?
Well, I mean, racism is a big link of it, and that's why we're putting in, we put it in before, and we're putting in, again, training, and not just a one-time training, but ongoing training. And there's been studies that prove that patients do better when the doctor looks like them. There's been studies that show immigrants have a baby in their native country, and then when they come here, they have more problems. So racism is a part of it, systemic racism, and that's what we have to work on also.
You believe it's systemic racism in the United States that's to blame for some of these outcomes?
Definitely. And, we have to change hearts. That's part of it.
Can you talk about where you hope this legislation will reach? I understand it's federally funded hospitals, it's potentially tribal health centers as well.
Sure. Hospitals, birthing centers, healthcare, clinics that service moms that are pregnant.
Representative Kelly, you're a mother yourself.
Yes, I am.
Why has this been so important for you to champion as a mother, as a lawmaker?
I had no idea that this was happening until someone called me up and said, I want to tell you a story. And that was about 9 years ago. And I was astonished when I heard the story. I did not realize it was such an issue. And I hit the ground running and just learned how many people have been impacted by this.
Well, we will be tracking this very closely, and appreciate you making the time
Thank you.
Quickly. Thank you so much.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app, or watch live on our YouTube channel.